Title of today's hangout is the integrated alternative medicine model is not functional medicine. And I am Dr. Martin Rutherford. I am a certified functional medicine practitioner, which takes on more and more meaning to me as time goes on. And I am a chiropractor since 1979.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor. And today we're going to be really talking about the dichotomy between these two models, because there's a growing interest that we're observing in the population of people who maybe want to become less reliant on drugs. People maybe, this is what we're hearing, maybe they're tired of the healthcare system. They're tired of the 5-minute doctor visit. They're tired of being passed from specialist to specialist without anybody seeming to read the other person's notes. And as a result, they start seeking more natural alternatives. And to these patients, the natural alternatives, they kind of lump them together.
But so that's really, model number one. That's the medical model. We're not going to talk about that. Everybody seems to be pretty familiar with that.
But when you go to natural alternatives, when you lump everybody together, really there are some pretty substantial differences between different doctors and how they practice in this model. If somebody's saying they're doing functional medicine, we want to make sure you really understand if they are doing functional medicine or not. If they're not doing functional medicine, are they doing more integrated versus alternative medicine? So why don't you kind of take us through the two models, like an integrated model versus a functional medicine model.
Okay, and that seems to be the confusion, and I get this. So just for those of you who may have never seen us, okay, we have developed a chronic pain practice here. We do fibromyalgia, everybody does fibromyalgia, right? We do chronic fatigue, everybody does chronic fatigue. Fibromyalgia, chronic fatigue, we morphed heavily towards a lot of neurological issues because Dr. Gates is a functional neurologist who has a lot of techniques that work like amazingly. There's a little bit of a non-objective thing for like dizziness, vertigo, balance, migraine, peripheral neuropathy, and believe it or not, chronic fatigue and fibromyalgia and things of that nature. I was the original functional medicine doctor. I had the honor to work with Dr. Detox, who I happened to have a chance to chat with this weekend, which was very nice because I haven't seen him in a little while. And I kind of think of him as the father of functional medicine, and the concept that there are multiple vicious cycles going on. To be more clear on this, okay? Functional medicine started out when it was suggested that diet and supplements could change people's physiology, and indeed it can. People have gone to the medical doctor now. You have fibromyalgia. We'll talk about fibromyalgia. We think that would be good. And you want to talk about thyroid?
I think thyroid.
I will use thyroid as an example. Perfect. So you get hypothyroid symptoms. You go to the doctor. The doctor says you got your thyroid hormones are off according to the test, and then they give you a thyroid hormone. It works. You're wonderful, and you don't look for anything. On the rare occasion that it works, and you're wonderful, you don't have to look any farther. But if it doesn't work, eventually people start looking for an alternative model, as Dr. Gates just got done saying, and so that alternative model now is being divided into two, I would say 3 disciplines, okay? The one discipline is the anti-aging medicine, alternative medical doctor approach. And the alternative medical doctor approach is, and a lot of people are attracted to this because it's a medical doctor. And the medical doctor rises above, because the medical doctor who wants to do the alternative approach must understand them both. But the medical model, and we've been to these classes, okay, but the integrated alternative medical model is still the model of find a symptom, find a potential cause, and attack it. So if you come in there with thyroid problems, and you have an improper thyroid, and you have a bad gut, and you have heavy metals, and you have parasites, and you have H. pylori, and you're going to get an herb, a botanical, a homeopathic medicine, a drug, because these are still medical doctors who are still using that medical model of give a drug for the symptom, give a drug for the problem. But now they've morphed into give a drug, give a chelation, give a herb, give a botanical. So it's kind of a menu-ish type of buffet-ish type of a thing. Well, let's see, you have all these symptoms. Let's try this and see what happens. And what doesn't happen, if it doesn't happen, then we'll try this. Then we'll try that. Some people, that's not attractive to. So they go into the, what they think now is the functional medicine model. Am I going there? Is that
yeah,
okay? So the functional medicine model is a very sophisticated model, okay? And it's a model that requires a lengthy history relative to that person's specific exam. And functional medicine doctors are taught to do a very condition-specific examination, come up with a diagnosis, do very specific testing relative to their finding of multiple vicious cycles that are going on in that patient. So if it's a thyroid problem, that person may be in post-traumatic stress syndrome, flooding themselves with stress hormones. That patient may have leaky gut, but that leaky gut may also be leading to food sensitivities, inflammation in the brain. It might be causing something called lipopolysaccharides, screwing up your insulin, which is screwing up your testosterone, which is their Hashimoto's may be flaring off and creating inflammation that's damaging the nerve endings, causing that thyroid patient to have fibromyalgia. These are complex cases. What has happened is and we did maybe not as effective a program, I don't know, maybe a year ago, October, on functional medicine. What is happening is that there is a group out there that is an alternative model that surrounds itself, that presents itself as being able to handle these things with diet and supplements. Again, maybe not entirely different from the previous two models, except I'm going to put you on a diet. Different people have different diets that they use as their go-to diet. Some it's the autoimmune paleo diet, some it's the paleo diet, some it's the FODMAP diet. It just depends on who you're going to. There's no one diet, as Dr. Gates is probably going to tell you. And then there is maybe some testing. And then there's a supplement for everything that's going on. And still, there is strictly management by the test. This is not functional medicine, okay? I'm not putting it down. It's going to work for some people. This is dietary medicine. This is nutritional medicine. But this is not pulling out the specific overriding vicious cycles that have collapsed in this patient from the time they were a child, who I was stressed when I was a child. I started causing all stress hormones. That screwed up my brain. That screwed up my short-term memory loss. That screwed up my sex hormones. It started giving me urinary tract infections. It screwed up my gut. And then the next thing you know, I got Epstein-Barr virus. And the next thing you know, I went into fatigue. And all of a sudden I started putting on weight. My hair started, but it wasn't that bad. But then later on, I got a flu. And the next thing you know, I started getting anxiety. These are multiple vicious cycles that are not going to respond to either one of those, to any of those previous methods, in my opinion, based on what we've seen here. Okay. So the functional medicine model is the last model. And so you have, to me, you actually have four distinct models. It was interesting. Dr. Karazian talked about 4 distinct models. He talked about some models, and we were talking like, this is what we face every single day, is that confusion of people coming in here saying, I'm looking for functional medicine. So what diet do I need? When am I going to get on a diet? How's the diet? And okay, well, it's going to be 3 or 4 or 5 or 6 weeks before you can examine me, because we kind of have a little bit of a waiting list there. And what can I do in the meantime? Well, the answer is you got to wait in the meantime until we figure out what's wrong and go with what is specifically the correct path for that person. So those are the 3 models. You can add anything that you want.
So let's use thyroid or hypothyroidism as an example. So we're not even going to talk about the mainstream medical treatment because we've kind of already pushed that to the side. So let's say you're seeing an alternative or integrated health practitioner for your hypothyroidism or hypothyroid symptoms. So lots of times they may have a different way of viewing the thyroid. So they may say, you know, your thyroid tests are really pretty normal according to the common standards, but according to my standard or these new standards, I see patients like you, they do well on a thyroid medication or a thyroid glandular like Armour Thyroid or Nature Thyroid. So we're going to give you some of that. And then also we see based on your blood test that you're deficient in iodine, and the thyroid needs iodine for it to make thyroid hormone. So we're going to give you some iodine. And then on your heavy metal test, we see that you have high levels of bismuth. So because of that, we're going to need to chelate you, because if you have heavy metal intoxication, then we need to get the metals out of you. So we're going to give you heavy metals. And oh yeah, the thyroid uses selenium. So we're going to have you take selenium basically to help your thyroid and also to convert your inactive thyroid hormones to active. And oh yeah, you know what? The liver can be abnormal in some thyroid patients. So let's give you a liver detox. And then also let's put you on a gluten-free diet or gluten and casein-free diet, because those have been shown to affect the thyroid. So it's like vomiting out a treatment, bam, this is what you have. You're going to do this for whatever amount of time, see me in a month, and then we'll adjust from there. Maybe then we'll look at your female hormones or your male hormones, blah, blah, blah. And we're not, I know this may seem like a criticism. This is not a criticism against MDs, DOs, or chiropractors, because there are MDs, DOs, and chiropractors who do this type of treatment. But we want to delineate that's not functional medicine. That's nutritional medicine, as Dr. Rutherford said. That's integrative medicine, basically. It's not functional medicine. The functional medicine approach says, as Dr. Rutherford said, multiple vicious cycles. What that really means is that when you have an autoimmune issue to your thyroid, and that's causing your thyroid to be low, that may be happening because you have food allergies in your gut. Think of it that way. They're not really food allergies, but think of food allergies in your gut to something like gluten. Might be 10 or 20 other foods. Or maybe you have a viral infection in your thyroid, or maybe you have some other toxin coming into your body causing your immune system to spiral out of control and have a proclivity to attack your thyroid. So the functional medicine approach is, well, let's attack one thing at a time and see if the other vicious cycles, the other dominoes, if they don't fall as well. So
there's a very organized approach to determine which one thing to attack first that has the probability of resyncing.
Exactly. Because, for example, in our practice,
the other cycles,
you know, we use selenium. Let me tell you, selenium really didn't do much for most of our hypothyroid Hashimoto's patients. So in this organized fashion, you can go through and hit the big things first. And maybe you have to work on the gut first. As Dr. Rutherford said, there is no one diet. So I have some hypothyroid patients that are on a paleo diet. I have other hypothyroid patients that are on a vegetarian low FODMAP diet. I have other hypothyroid patients who are on an SCD diet. You have to evaluate so many factors when you're evaluating one system to get that fully corrected. And then we recheck the labs and we say, okay, are we making progress? Yes or no. We recheck symptoms too. Are we making progress? Yes or no. Then we go to the next cycle or system, so to speak. So then maybe we'll start working with Epstein-Barr virus, or we'll start working with autoimmunity specifically by itself. But you have to handle these things in a stepwise fashion rather than just back up the truck and dump everything out on the patient fashion.
Just maybe a point of clarity there. So when you start working on the first cycle, you're going to see a lot of things clear up. Then that brings more clarity to which next cycle to go to.
Right.
And then you go to that next cycle and that's going to clear a lot of things up, as opposed, so maybe you have 15 or 20 symptoms that have already gone away without having given a specific supplement or Medicare for each one of those 15 or 20 symptoms. You might have used 4 or 5 supplements or 6 supplements or less. And by the time you get done with that cycle, you may not need all those supplements.
Right.
And then you move on to the next cycle.
Right. And that's basically it. I mean, we can keep going, but I don't want to overcomplicate it. That's the model. And we use thyroid as an example. We could talk about chronic fatigue. We could talk about fibromyalgia. But hopefully you can go back and watch this and really get there are distinct differences here. And just because 2 practitioners are prescribing vitamins or herbs or botanicals does not mean they're doing the same thing or have the same treatment. Just know that they're very, very, very different. And again, there's an explosion right now. Really, you're starting to see more and more doctors, chiropractors, DOs, MDs who are going into this field of integrative and alternative medicine. Why? Because a lot of them are tired with the standard insurance model. They're tired of, working for just hospitals or just, working for the insurance code. And that's all well and good, but a lot of these doctors are calling themselves functional medicine. And really what we just explained over here is not functional medicine. That's integrative nutritional medicine. All well and good, but it's not functional medicine. Functional medicine looks to get to the underlying cause, address things in a systems, organized-based approach with the long-term intention of getting you on less supplements than more, versus what we hear from the nutritional-based approach. Lots of times patients come in carrying bags of supplements, saying, well, I got a supplement for this, I got a supplement for that. And they may be reacting to 10 of those supplements.
What we find is, for the most part, less supplements are better, which is very, very different from the approach that of diet, standard diet and a supplement for every symptom. And when Dr. Gates says getting to the approach, I mean, getting to the cause. I'm a chiropractor. I've done nutrition. I've done supplements earlier in my career for several years. I didn't feel like I was getting to the cause of the problem. And that was my intuition, even though all my colleagues said, well, you're giving them a blood sugar diet, and then you're doing a muscle test, which I did, and then you're giving them something for their stomach. So I give them hydrochloric acid for their acid indigestion. They're better. They're confused. Why are you giving me hydrochloric acid when the medical model said, I need to kill all the hydrochloric acid with my antacid? That's wrong. This is right, because you didn't have enough. You feel better. Now, I, as an alternative practitioner, would say we got to the cause of the problem. We didn't get to the cause of the problem. Functional medicine gets to the cause of the problem, because functional medicine, functional neurology, which is why we put our two disciplines together, would say, you're kind of in post-traumatic stress syndrome, which is flooding your gut with stress hormones, and it's damaging your ability to make hydrochloric acid. Let's calm down that brain. Let's calm down that stress mechanism. And you don't need to take omeprazole or apple cider vinegar or hydrochloric acid from any of those disciplines, because you're not stressed anymore. Your brain's not in post-traumatic stress syndrome. That's getting to the cause of the problem. If it's functional medicine and it's thyroid, you find out what's going on with the thyroid, because thyroid can cause your stomach to not make enough hydrochloric acid. So now, what's the problem? The problem is the thyroid. Well, now the problem is, what's causing the thyroid problem? Now you take care of that, the thyroid starts working, you start making enough hydrochloric acid. No omeprazole, no hydrochloric acid, no Bragg's aminos. We're not against any of those things. We're just telling you that's not functional. That's not functional medicine. Functional medicine is the first time I felt like in my life I could say we're getting to the cause of the problem. And there are hundreds of pathways like that. Hundreds of biochemical pathways, neurological pathways, biochemical hormonal pathways, biochemical stress pathways. And if you can understand that, and you can do a proper history and do an exam, those hundreds of pathways kind of disappear. And all of a sudden you got maybe 3 or 4 or 5 or 6 pathways sitting in front of you with that patient. If you've done it long enough, you know which ones are the most important ones to take first, because these pathways actually influence these. You hit this one, all these go away. You hit this one, these go away, and you're there. Or maybe there's one more thing to do, and now it becomes extremely obvious as to what the last thing is. And now you go on with your life with tools to keep those pathways under control. And it usually results in less supplements. It results in a mind-numbingly precise dietary recommendation, because that's how it has to be for you, not just to get better, but for you to have the tools to stay better without having to go to the doctor for the rest of your life, because they need to keep managing the new things that pop up. Well, new things don't pop up if you take care of them properly in the beginning. That's functional medicine. That's functional neurology. We put them both together, and so there are different models. That was really the point of this. There's the medical model. There's the nutritional, dietary model of diet, supplements. There's the integrative model of the medical doctor, who is just integrating everything essentially. but in a very disorganized fashion, in my opinion. And I'm not being insulted, because I went to these folks when I got sick. For those of you who never saw this, I developed fibromyalgia, peripheral neuropathy, chronic fatigue, fibromyalgia, I already said that, peripheral neuropathy, what else? Hashimoto, celiac,
right.
those types of things. So the point being, I went through this. So I'm speaking from experience, and I finally got to it, and I did it all. And then finally I got to a doctor who worked with the brain functionally, calmed my stress mechanisms down, got to a doctor who started to train me on these multiple vicious cycles. And it was like, and I got better. Okay, so we're talking from a clinical perspective, we're talking from a personal perspective, and we're trying to make our job easier by delineating these different models for people before they get to our office. But really, most of you are going to come to our office. So we're trying to do this so you have better tools to kind of look around and go, oh, this is that model. Well, I like that. Why don't I try the diet and the supplements and see if it works? And if it doesn't, you'll go, oh, they told me it wasn't going to work for this. Or maybe you had something that worked for it. Maybe you have basic gut problem, and you changed your diet, and you took some pancreatic enzymes, you took some hydrochloric acid, and it worked. We're not saying that doesn't work for anything.
Mm-hmm.
But if you have complex cases, I mean, if you've tried all that, it's not working, and you think you've been to a functional medicine doctor, and the diet and the given the supplement thing sounds like what you've been to, that's not functional medicine. What happens is a lot of people go, I already tried functional medicine, because the water is being muddied. Functional medicine is not it's not controlled, it's not regulated.
Right.
Anybody can say they're a functional medicine doctor, anybody. But in truth, I would say the functional medicine, you should have a degree, a baseline degree of nursing, medical. You should probably be maybe a naturopath, chiropractor, a baseline degree, and probably another 450 hours or so for functional medicine, and same thing for functional neurology. So now you're talking like 900 hours if you were to do both of those. And now you know just enough to be dangerous. Mm-hmm. At that point, you start treating patients and find out how these things really sync. And so it's complex, and there's not a ton of people who really genuinely do functional medicine. We know that because we've interviewed the who's who of functional medicine. We were talking to one gentleman there yesterday who kind of acknowledged that not a lot of people in that room that we were in. We were at a seminar this weekend. There were about 350 people there. He acknowledged not many of those people are going to do this. We talked to the person who developed the term. Well, we talked to his people. It's functional medicine, and out of all the years that they've been doing functional medicine classes, they decided, they said maybe about 350 people in the country are doing functional medicine out of their classes, and they've taught thousands and thousands and thousands of people. It's just not a lot of people out there doing this model the way it's supposed to be done. Let me tell you, when it's done the way it's supposed to be done, it's pretty powerful, and it's clear, and it's precise, and you can give the person a prognosis, and you can say, here's what you have, and here's what we're going to do, and here's how it's going to work, and here's how long it's going to take. And when you start hearing those types of things, you're going to know you're sitting in front of a well-trained functional medicine practitioner. But when you start hearing, well, we're going to do this diet, and here's your test, and okay, you have all these things, so I'm giving you this for that, and that for this, and this for that, and this for that. That's not functional medicine. It might work for what you have, and if it does, great. But if it doesn't, don't think you've been to a functional medicine doctor, and so functional medicine didn't work.
Exactly.
No, it's good.
Yeah, it's good. Okay.
Sounds like you think that covers it.
I think it covers it.
Okay.
Yeah.
When he thinks it's covered, it's covered.
Yeah. So if you have any comments, send them to us on powerhealthtalk.com. You can get today's broadcast on that website as well. We didn't really attach any references because this was more our clinical experience rather than being a broadcast where we're talking about migraines or fibromyalgia, where we try to put 10 to 20 peer-reviewed references. But anyways, we appreciate you watching. Keep watching for more exciting broadcasts in the future. We'll see you soon.